right. Thank you for being here today. I just wanted to introduce Dr. Oster. He is the Corporate Medical Director with Quality Life Services. He also holds the position of Regional Medical Director with Preferred Providers Health Plan of Pennsylvania. In addition to his work with Quality Life Services, Dr. Oster is a physician with Butler Health Systems, BHS Extended Care Associates. Thank you for being here today.
Oh, my pleasure, Julia.
All right, well, I'm just going to jump into the questions because the COVID-19 vaccine is prevalent in the media and people have lots of questions about what it is and if they should get it. So I'm just going to jump right into it. I was reading reports from Moderna and Pfizer that show the success rate of the vaccine trials are 94 to 95% successful. What are your thoughts on their testing trials, and do you feel like this is accurate?
Well, it's important to understand what is actually meant by the effectiveness, or what we in the medical world would call the efficacy of the vaccine. And in two large studies, one for each of the vaccines on the horizon, which is the Pfizer and the Moderna vaccines, tens of thousands of people were studied. Of each group, half were given the vaccine and half were given what we call a placebo, an inert substance. And it was found that the number of people becoming sick with COVID among the vaccinated group was reduced by 95% over those who received the placebo. Translated another way, that would mean that if 100 people were expected to get sick or actually did get sick while receiving the placebo, that number was reduced to just 5 people who became ill even after receiving one of the two vaccines. Even more importantly, the number of people who became severely low was reduced to just a mere handful among those who received the vaccines. So not only did less people become symptomatically ill with the vaccine, but very few people actually became severely ill.
Wow. Per the CDC, a top policy question is, should healthcare personnel and residents of long-term care facilities be offered the COVID-19 vaccine during the first round, or phase 1A? What do you feel? Do you feel like that is the right population to start with, or how do you feel that it will affect long-term care residents?
Well, of course, I have a biased point of view because I am a healthcare professional. And these days I've been taking care of COVID positive patients on a daily basis. But in all honesty and objectivity, healthcare workers since the beginning of this pandemic have put their own personal health and even their lives at risk in doing what we have been trained to do. I certainly believe that there's a debt from society to give us the vaccine first. Additionally, giving healthcare workers, and by that I mean physicians, nurses, aides, the entire spectrum of people who come in contact with patients on a person-to-person basis, by giving those people, those courageous people, the vaccine, we're not only protecting them from disease, but we also believe that we'll be protecting those patients or residents they care for, as well as the families that we go home to. I absolutely endorse the CDC's recommendation, which Governor Wolf has also endorsed, and that is what's already being done with the Pfizer vaccine.
And that leads me into my next question in regards to Pennsylvania Governor Wolf. If you could directly speak with him regarding the prioritization of the COVID-19 vaccine, what would you say to him as a physician for long-term care residents? I know you touched on that, being that the frontline workers, the healthcare workers, should be at the top of the list. And do you hold that true with long-term care residents? Are they one of the first groups that you feel really need to get that vaccine in?
Yeah, so unfortunately, Governor Wolf hasn't been calling me that frequently these days, but he's already decided on the issue, and I would tell him that I fully support his decision. First, to prioritize the healthcare workers, who are coming in regular contact with COVID positive patients, and then to prioritize those residents of long-term care facilities. It's very unfortunate that over a third of all the deaths in the United States from the COVID pandemic has occurred in residents of long-term care facilities. We know that these residents are particularly vulnerable because of the generally close quarters of long-term care facilities, and because of the diseases that most of these residents have. They're older, they have chronic illnesses, and they're the ones who are most seriously affected by COVID. The one thing I would add to that I'm not sure Governor Wolf has prioritized is to make sure that personal care homes and assisted living facilities are included with skilled nursing facilities in terms of prioritization of these vaccines.
What would you say to a community member that hears such conflicting stories about the COVID-19 vaccine in regards to long-term care residents when they feel that it could hasten or speed up their disease state by getting the vaccine? Are you able to dispel that myth and say that those two don't correlate?
Yeah, there's no evidence that COVID hastens or makes more aggressive the disease processes that residents of long-term care facilities commonly have, or any illnesses whatsoever. So there was a remarkable safety profile among the tens of thousands of people who received the vaccine. So there's certainly no evidence of harm coming to those recipients. On the flip side, as I already mentioned, we know the tremendous harm and fatality rate that has occurred to the long-term care residents who have become infected with COVID. So in medicine, like in many fields, we weigh the benefits versus the risks. And particularly in the long-term care setting, the benefits of vaccination far outweigh any risks, which at this point seem to be negligible.
Do you foresee a reliable calendar window for when the distribution of vaccine can be to the public?
Again, the leaders of Operation Warp Speed have not been briefing me regularly, but from what I read in the lay press, it's certainly hoped that tens of millions of Americans will be vaccinated by the spring, and hopefully the majority of the population by the beginning of summer. So the officials seem to be on target for that. I believe I've read that 100 million doses of both the Pfizer and Moderna vaccines are expected by spring. So that certainly provides a very good start.
Here's to a positive outlook for 2021 to start with.
Exactly.
And if there isn't an initiative named Warp Speed, there needs to be. That I like that very much.
I wish I could lay claim to the coining the phrase.
What would you tell the community at large, or really anyone who hasn't done research yet and maybe wants to start like at the very basic minimum level? Are there any types of research material or websites that you suggest to start gathering information if they're considering the vaccine?
Yeah, I recommend the CDC website, which can be, anybody can just Google CDC, you'll get the website. It gives quite a bit of information written both for healthcare professionals and for lay people, and it's a very good place to start. I would caution against visiting any sites that have a particular political agenda. They're much more likely to be skewed. So certainly start with the CDC.
All right. And lastly, is there anything else that you want to touch upon or mention in regards to the COVID-19 vaccine with long-term care residents or just the public at large that you want to touch on before we
Yeah.
wrap the interview up?
Just very briefly, I'm aware in the lay press of conspiracy theories, mistruths, misconceptions around the vaccine. There's been some concern raised because the mechanism by which the vaccine works is rather novel. It's not the first time it has been used in the vaccination against certain cancers. I don't want to bore our listeners here with some of the detailed biology, but this is a what's called a messenger RNA vaccine. And it's been misconstrued as changing the genetic makeup of the person receiving the vaccination. That is untrue. Messenger RNA is a copy of our DNA, and nothing in the vaccine permanently changes or could even possibly change our genetic makeup or cause mutations. So anyone who has that fear, there's no biologic basis for that. Also, the government is not going to be tracking us through these injections, so there's no need to worry about that. And like I've said before, in the trial of tens of thousands of people, the vaccine proved to be quite safe. So I'm confident, I'm anxious to and eager to receive the vaccine at my first opportunity as well.
Well, thank you so much for the information. I really appreciate it, and I'm sure all of the Quality Life Service resident families who are watching appreciate it too. And just to reiterate, if you want to visit the CDC website for more information, go to Google, go to any internet, and you can look that up. If you have any questions, you can always call Quality Life Services. And thank you again, Dr. Oster, for being here with me today. Our first Zoom recorded meeting, so I hope everything works out and we can get it out for the community to see. So thank you very much for your time.
Oh, my pleasure. Thank you, Julia.
Thank you.